Good afternoon to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. M. Balasubramaniam. Sir is MD, DV, graduate and postgraduated from Madras Medical College. Sir is former State Secretary, President and National Vice President of IMA, Founder Secretary and past Chairman of Professional Protection Scheme of IMA Tamil Nadu. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is POCSO Act, which is Prevention of Child Sexual Offence Act. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Thank you, Sriyan, and thanks to IJCP for yet another opportunity to me. Today, we will discuss about POCSO Act. Sometimes it is also called as POCSO Act. Even though we say it is Prevention of Child Sexual Offences Act, this act is enacted for the protection of children from sexual offences by known and unknown people. Let me start with the question. Till what age a child is included? Is it 12 years, 16 years, or 18 years? Yeah, many of you will be knowing it, but many people, they think, especially they take the child to the pediatrician till the age of 12. But the answer here is 18 years. Up to 18 years, we call it a child, and after that only adolescent and adult. Right. This POCSO Act, does it include girls, boys, or both? Many of you will be correct. It includes both. It is not that only the girls are abused. Many times we see boys are also being abused. We call it as homosexual activity or the thing. So POCSO Act, it includes both girls and boys. Right. Today's children are tomorrow's treasure for any nation, leave alone India. Abdul Kalam was concentrating on children, motivating them to become a better citizen so that India becomes a powerful country by 2020. In India, we have 47.2 crores. That is 39% of the population are children. 29 of this figure constitute children between the age of 0 to 6 years. So up to 39% of the population are children, that is up to 18 years, of which of this 47.2 crores, 29% are in the age group of 0 to 6 years. Many of us know about the Article 14, equal rights for everybody. The Article 15 of the Constitution empowered the state to make special provisions for children. This POCSO, Prevention of Children from Sexual Offences, this act was enacted in 2012. Many of the other countries also they have. Following those countries, we also enacted this law. It was amended in 2019 with stringent punishment. The punishment were not that much in 2012 when it was introduced, but the amendment in 2019 made the punishment more severe and the act became more stringent. The rules were published in 2020. These rules includes 9 chapters and 46 sections. So in the verdict or things, the judge will quote under the section of the 46 section, maybe 12, 14 like that, you will quote and give the punishment. The gender is neutral. It will not be he or she, the child. They will mention only the child. It includes both boys and girls and children under the 18 years of age. What about IPC before introduction of POCSO in 2012? We were dealing with these offences under raping. Raping was including both adults and children, but children were brought to the open court and they felt very much embarrassed to stand in the court along with the adults and other things. So separate act has been enacted, which I'll tell about how it is being done also. The objective of POCSO Act is a comprehensive law to provide for the protection of children from the offences of sexual assault, sexual harassment, and pornography. It is not only the offence include both sexual assault, sexual harassment, and also pornography. Safeguarding the interest of the child at every stage of the judicial process. Judicial process has been streamlined so that it takes place quickly and the interest of the child is taken care of during the every stage of the judicial process. Incorporating child-friendly mechanism for reporting, it starts with reporting, recording of evidences, investigation by the law officer, and speedy trial of offences through designated special courts. So it is not the ordinary judicial or civil court which deals. This is a designated special court. So let us see the punishment. What are the types and punishment? Penetrative sexual assault. Penetrative sexual assault, the punishment is 20 years or imprisonment for life till death. It is not 20 years or 14 years. Life prisoners are let off by 14 years if they have good contact in the jail. Here it is till death and fine to be paid to the victim to meet medical expenses and rehabilitation. Usually IPC denotes many times only the punishment. Fine is very meager. Here the fine is to be paid to the victim to meet the medical expenses and rehabilitation. Aggravated penetrative sexual assault. The punishment is the same. What we mean by aggravated, if along with the assault, the girl becomes pregnant or the girl or boy gets a sexually transmitted disease, maybe including AIDS also. So the punishment is the same. Sexual assault, it is simple thing, 3 to 5 years and fine. Aggravated sexual assault, 5 to 7 years and fine. Sexual harassment, they need not assault. Even if they harass the child, 3 years and fine. Using a child for pornography, even if they do not assault or harass, but take a video photograph or plain photograph and publish in the media for people to see as a porno. First time, the punishment is 5 years and fine. If it is second time, 7 years and fine. Storage of pornography, first time 5,000 fine and second time 10,000 fine. So anybody having the pornography in their mobile, they can be fined 5,000 for the first time and 10,000 for the second time. But they will not be arrested. Storage of pornography for commercial purpose. If you sell the things or just transfer, forward it to some other person, and then the person will be imprisonment. Will be there. First time 3 years, second time 5 years. So if they take pornography, first time 5 years and second time 7 years. If you store pornography for commercial purpose, first time 3 years, and second time 5 years. Abetment and attempt to commit an offense, half of the punishment of the thing. Even if they try, take the child to a secluded place and try to take a video, and if you are caught, then half the punishment will be given. So, general principles for the use of professional and experts assisting the child at pre-trial and trial stages. What are they? Right to life and survival. Best interest of the child is the primary intention. Right to be treated with dignity and compassion. The right to be protected from discrimination. Right to special preventive measures. Right to be informed. Right to be heard and to express views and concern. Even if it is a child, we have to hear the child's words, and the child will be permitted to express views. Right to effective assistance, right to privacy, right to be protected from hardships during justice process, right to safety, and right to compensation also. So these are the rights that are bestowed with the child when the trial is taking place. The guidelines is the Act provides for mandatory reporting of sexual offense. So anybody coming to know that as offense to a child, sexual offense is been committed or tried to be committed, this has to be reported. See, for example, if the doctor sees a child with some pain over the genitalia, on examination, she feels the doctor finds some injuries in the genitalia and elicits the history that she has been mishandled like that. It is the duty of the doctor to report. It is not the ask the parents to go to the. If the doctor has seen a case of child sexual offense, the child doctor has to report. Failing to report is punishable with imprisonment of 6 months or a fine. So you have to see that either the parent go and report, or you call the local police station and inform such an offense has been taken place. Police personnel not below the rank of sub-inspector receiving the report of sexual abuse of the child visit the victim of the house in civil dress. So the police officer should not go in police uniform. He or she has to go in civil dress, usually with a t-shirt and other things, and salwar kameez like that, and act as a child protector. So it is the duty of the sub-inspector, maybe a male sub-inspector or female. Many times we have female sub-inspectors in almost every police station, and she will go and see. The police personnel are given the responsibility of obtaining emergency medical treatment. Suppose if the parent reports to the police station, the sub-inspector goes home in civil dress and sees the child. It is the duty of the sub-inspector to take the child to the medical thing. Usually it is a government office, and medical treatment has to be arranged by the sub-inspector. Or they can place the child in the shelter home. If the parents themselves are helping in sexual offences, then the sub-inspector has got all the rights to take the child to a shelter home and keep the child till trial. Police officer is required to bring the matter to the attention of Child Welfare Committee. We have a Child Welfare Committee in every district in the collectoral office. So the sub-inspector has to report to the Child Welfare Committee within 24 hours of receiving the report. So he cannot delay or delete the things and try to do some mediation like that. It has to be reported within 24 hours. Medical examination is to be carried out in the presence of parent or other person whom the child trusts. So the sub-inspector takes the child to the hospital, usually in government hospital, and the examination of the child by the doctor has to be in the presence of the parent or any other person. In case of female child, a female doctor should examine. So a male doctor can examine a male victim, but a female victim should be seen only by a female doctor. The report to be submitted within 24 hours. See, many times in police, medical legal case is brought to the government hospital, we do not give the wound certificate and other things. We say we send it to the forensic lab and other things. So we cannot take our own time. At least the initial report has to be submitted within 24. So the police has to intimate the Child Welfare Committee within 24 hours, and the doctor, after examining, has to give the report within 24 hours. A special public justice delayed is justice denied. So we cannot let loose the things. It has to done immediately. A special public prosecutor is nominated on behalf of the child. So this Child Welfare Committee nominates a special public prosecutor. The special court conduct the trial in camera. No visitors or things are allowed. It is conducted in a closed hall. We save the trial in camera. A multi-sectorial intervention is needed to minimize the risk of health problems, enhance the recovery of the child, and prevent further trauma. So what is required is, first we have to recover the child and also prevent further trauma to the child. So as a doctor, this program is mainly for the doctor, and role of the doctor having an in-depth understanding of sexual victimization. The doctor cannot say, I do not know about POCSO Act and I am not familiar, I have not seen such a case. Usually it is taken to a government hospital. If the parent or the thing they insist, they can be taken to private hospitals also. Obtaining a medical history of the child's experience in a facilitating, non-judgmental and empathetic manner. So every patient has to be dealt with empathy. So here, being a child, more empathy has to be given. It should be non-judgmental and should be in a facilitating thing, not in a hurting manner. Meticulously documenting historical details. So documentation is very, very important. Conducting a detailed examination to diagnose acute and chronic residual trauma and sexually transmitted diseases, and to collect the forensic evidences. Any presence of hair, semen like that, or injuries like that, it has to be done. Considering a differential diagnosis of behavioral complaints and physical signs that may mimic a sexual offense, abuse also should be considered, and it should be recorded. Obtaining a photographic or video documentation of all the diagnostic findings that appear to be residual to abuse. So need not take photography or video of the child, but whatever the materials you have collected from the child as an evidence has to be photographed, and video documentation should be applied. Formulating a complete and thorough medical report with diagnosis and recommendation for the treatment. So you have to say that such as a sexual assault has been taken place in such and such a manner at a such and such a time. Along with the offense, the child has suffered, these are the injuries she has suffered, or if any sexually transmitted disease is there, you have to mention in the report. Testifying in the court when required. So you cannot say I have given the report. We have to go to the court if someone is issued. We have to go and report in that special court. So if the child resists the examination, maybe even if it is a small child, if it resists vigorously, if a child of any age refuses the genital anal examination, it is a clinical judgment of how to proceed. You cannot force the child. At the same time, leave the child also. Rule of thumb is that physical exam should not cause trauma to the child. So we have to convince the child the doctor will not cause any harm or embarrassment. It may be wise to defer the examination under these circumstances. So taking the history and other thing, making the child to wait for some time, and when asking the parents to take care of the child. Never force the examination, especially if there are no reported symptoms or injuries. Sometimes first you can ask the nurse to, along with the mother, you can see the child, and then the doctor can see. What are the techniques to help the child to relax? Offer clear age-appropriate explanation for the reasons for each procedure and offer the child some control over the exam process. If you feel pain, you tell me, raise your hand, I'll stop then and there itself. Proceed slowly, explain each step in advance, use curtains to protect privacy if the child wishes, explains to a parent or support person that the job is to talk to and distract the child, and finding of the exam will be discussed with them after the exam is done. So I'll do the examination, you take care of the child. You just distract by having a conversation. The position of the parent should be near the child's head, not on the foot end. Use distractors. For example, ask the parent to sing a song, the song which a child likes, tell a familiar story, or read a book to the child. Nurse or other helper can do this if the parent is unable to tell it. Use TV, cell phone game, or other visual distraction. Do not forcibly restrain the child for the examination. What about sedation? Can we give sedation for a thing? Sedation is rarely needed if the child is informed about what will happen and there is adequate parental support for the child. Consider sedation or a general anesthetic only if the child refuses the examination and conditions requiring medical attention such as bleeding or a foreign body are suspected. If it is known that the abuse was drug assisted, child needs to be told that he or she will be given a sedative or be put to sleep, that this may feel similar to what he or she experiences in the past. Reassure the child about what will take place during the time under sedation and what he or she will be informed of the findings. However, conscious sedation is an option if the examination and evidence collection is required and the child is not able to cooperate. Speculum exam on a prepubertal girl should be done under anesthesia, not a conscious sedation. So these are the procedures a doctor has to follow. So a doctor in government service, usually the superintendent or the RMO, when such a case comes, they put a doctor intern to examine and think. So it is the duty of the all lady doctors to know about this POCSO Act and how to examine and other things. And male doctors also, especially the pediatrician, should be familiar to examine a male victim. And you have to documentation is very important. And whenever it is required, you have to go to the court and give the expert evidence. Here, I would like to tell prevention is better than cure. So, how to prevent this? So, this sexual offense is taking place for so many years, in almost in all the countries, all the cultures, all the societies. So it is up to the parent and the teachers to educate a child. That is why we have a very good teaching called good touch and bad touch. So every child, let it be male, a boy or girl, should be taught about good touch and bad touch by the parents, especially the mother, and teacher at school. So when the child knows someone, it is not the unknown person. We always caution the child not to accept any sweets, chocolates from a person, any person not known. But here, many times, it is the known person who is abusing the child sexually. So they attempt with the chocolate or ice cream like that, make the child happy, and while the child is taking the sweets or ice cream, they indulge in the foul play. So whenever yeah, when the child is taken to a private place, and if the person touches the private areas, the child should scream, no. Child should shout, no, and move away from that place and move to the parents or person known to them, maybe teacher or a mother or father or uncle or auntie, and tell that such a person has misbehaved. So then the elders will take care and prevent further happenings, or if it has happened, many things. Many times it happens and the child returns home, and many times the child is irritated or agitated, or goes to sleep or something like that. And many times we have seen that the child is again and again being misused or sexually exploited by the offering of chocolates and ice cream and other things. So we, the medical people, have got a very important role in the prevention of such a crime, because this will spoil the future of the child. Let it be male or female, the future of the child will be spoiled, and any country cannot afford, or any family cannot afford to have a spoiled child in their house or in the country. So we have to help the lawmakers and the law protectors, that we help them as a medical personnel, and see that the people who are indulging in these heinous crimes are being booked and punished. If there is any questions, I'll be glad to take.
Yes, sir, there are some questions. So, sir, the first question from our audience is, what are the challenges and benefits of interdisciplinary collaboration in these cases?
Yes, it has to be interdisciplinary, no other go. See, here the first person will be family, parents, or school. The first role is the school or parents. The thing is there. Then we have to report it to the police station. It is the things. So police has to come here, and they have to take the child to the hospital. So medical people, they come. And this has to be reported to the district child welfare committee, and they will nominate one solicitor person to argue on behalf of the affected child. So here the Tahsildar comes to play. Even the collector has to supervise when he conduct the meeting, monthly review meeting. He has to inquire, and he should be aware of the POCSO Act. Now the media jumps. It is very difficult to protect the child from the media. Somehow they intrude and get the details. Only thing is they are forbidden to show the face of the child, but all rest of the things they show, even the culprits and other thing they show. Media, say everybody has got a mobile phone with a video recorder. So almost every even the bystander takes the things and he gives to the media. So So it is a multidisciplinary approach, and everybody have got their role, and things are there. So it is not the revenue people, it is not the police people, it is not the medical people, or the educational department. Entire thing, multidisciplinary participation has to be there.
Thank you, sir. Another question from our audience is, what resources and support services should doctor be aware of to refer patient for psychological counseling?
Yeah. See, initial thing in the medical examination, taking the history, medical examination, diagnosing whether it is a simple attempt or injury is there or a sexually transmitted disease is there. So it is the initial assessment and things. But we have to remember there is a psychological impact, and the child has to be referred good psychology, preferably if it is a lady victim, girl, it has to be referred to a lady psychologist and other things. Even in the rehabilitation, it is not getting the punishment for the culprit. It is the rehabilitation of the child which is more important. The child has to come out of this incident and has to concentrate on studies and life and other things. So rehabilitation can play a very important role, and here the psychologists or psychiatrists helps, and even the teachers and parents, they can be a good support and bring the child out of the psychological things. It is a shock. It is a thing which child has never seen or experienced. It is not, even though we say sex is pleasurable, here it is pain, and more things are there. So we have a role of the psychologist or psychiatrist. So we don't call them a psychiatrist. The psychological support we request in the rehabilitation.
Thank you so much, sir. There is one last question from our audience. What are the physical and behavioral indicators that may suggest a child is a victim of sexual abuse?
Yeah. See, it can, child can immediately come and report, or we can say a visible change in the behavior of the child. The child which goes for playing elsewhere, uh, uh, taking the permission or without permission of the parents or mother, if she goes for playing to the next house or next street or something like that, and if there is a delay there, and whenever the child returns, we need not have suspicion. We have to have a supervision of the child. You can just inquire where the child has gone, with whom she has played, in a rather in a friendly manner, and not in a suspicious manner, and other things. And better to change the dress whenever the child goes out and comes back. You say you have gone and played, and dirt will be there. You have to change the dress. So while changing dress itself, the child, mother can make out certain differences, scratch marks or injury to the genitals or bleeding. It may be there. And the child, after this incident, mostly it will keep on crying, or it will not speak at all. It will be in a remote place like that. It will not speak, it will not mingle with others. So then we have to, the parent or mother especially have to have a frank discussion with him, why you are looking sad, what had happened, what do you want. Well, like that, it can be in a subtle way so that the child comes out with the truth. If the child may not understand each and everything that has happened, but it will say, they narrate the things which have happened, and from this we can come to a conclusion that the child has been misuse or sexually abused. So necessary steps has to be taken. Many times the parents, they want to close the matter. They don't want to flare up so that the future of the child will be affected like that. By not reporting such an incident, these uh, perpetrators, they go carefree and they misuse other girls and boys also. So it is better we bring the things to them and punish so that we put a full stop. We do not encourage, we should never encourage or permit the perpetrators to prolong their foul activities. So it has to be done. Uh, so there will be visible changes in the behavior itself. The mother will be able to pick up in early, so that she can inquire and do it. So before happening itself, if she had told about good touch and bad touch and other things, did anyone else have a bad touch with you? The child will say yes, like that, like that. So it is always we should teach the thing, good touch and bad touch. We have so many videos are there. Even the popular actors, they have participated in this good touch and bad touch. So we can tell them instead of showing them video games and other things, we can tell them when they are receptive, so that such a thing can be prevented or exposed.
Thank you so much, sir, for answering all our questions. That's all from our audience, sir. So, sir, before concluding today's session, any last remark from you?
Yeah, see, the when the act was there, and even before 2012, these were there, but there were not reporting. Even though we had the act, much things were not there, and many of the responsibilities were not there. Especially the rules. We had the act, but we didn't have the elaborate rules. Nobody. So, what is the responsibility of the doctor? What is the responsibility of the sub-inspector? But these have been clearly mentioned in the amendment in 2019, and the rules have been framed by 220. So we have everything. So it is now it is very easy to know the responsibility of each and every person, and we can book the culprit and uh, bring them under this. This is a non-bailable offense. And they cannot get the bail or anything like that. And it is being done in a special court, speedy court. So here only it was given, only 24 hours is given for the sub-inspector to report to the welfare. Only 24 hours for the doctor to give the medical report. So they cannot, no delay can be there. So it has been speeded up, and many things are there. And now we have many lady people and social activists are there to take up the issue and see these people are being punished.
Thank you so much, sir, for joining us today. And with your permission,